Good afternoon and welcome. Thanks for joining us again today. It's our weekly update that we like to do from San Juan Regional Medical Center to let you know kind of how things are going in our community, having to do with our COVID circumstances as well as what's going on at the hospital. What I really want everybody to know, and kind of one of our big points today between myself and Dr. Lucas, is to let you know that we're the community hospital and we are here for whatever needs that you have available. We have had quite a run, of course, of COVID patients at our organization, but we're back open. We're back open completely. And so regardless of what your needs are, should you have an emergency, our emergency department is open. Stroke, heart attack, trauma, we're here and we're ready to take care of our public. The other thing that I want to say is all of our clinics are open as well with San Juan Health Partners, the primary care clinics, but also the specialty clinics. And we've got an array of opportunities to help care for our patients, whether those are in-person meetings or if we want to do those meetings online. We have the capacity to do virtual meetings as well. So please call your practitioner, call your provider. If you're in need of medical care, don't delay that. As the COVID numbers have declined nationwide, there has been an identification of patients who had been delaying care, running into problems because they did. So please don't delay care. We're here. We're available. We have the emergency department, urgent care, primary care clinics, specialty clinics, all with San Juan Health Partners and at San Juan Regional Medical Center, and our whole community of providers here in the Farmington area. So please don't delay. So you can join us as well on multiple media platforms to check on updates. We're available on Instagram. We're available on Facebook. So please follow our organization to keep updated on all of the things that we're doing. It's been really good, and things are greatly improving in the world of COVID as well. Like to say that on a state level, we've talked before about what we call that R effective, which is the number of patients that are infected with another person who is infected. The goal is to have that less than one, so it takes more than one person to affect another person. Well, in the state of New Mexico, that number is now 0.7, which means that we are trending down in the number of infections. Even better, in the northwest corner of the state where we are, and we're combined in terms of statistics with Cibola County, ourselves, and McKinley County. And so that number for the northwest corner of the state now is 0.2. That's the lowest it has been since we started tracking that data. So really good news as far as COVID is concerned in our community. We're certainly trending down in the number of cases. We have gone now, if you look at our 14-day rolling average of cases, we've been in the single digits on average for the last 2 weeks. So we couldn't be doing better than that. So it's continuing to trend down across the entirety of our organization and across our community and really across our state. The other thing that's an interesting statistic, which is also really good, is that although we went through a blip statewide, which luckily in the northwest corner we really didn't follow as much, the number of hospitalizations, the number of ICU bed requirements, and the number of deaths in our state has not mirrored that increase in the number of cases. We've continued to trend down in the needs that patients have for intense medical care. So again, great trends across the board. Here at San Juan Regional Medical Center, as of this morning, this is data that was accumulated as of August the 14th, 2020. Our inpatient census is 127 patients, and in that we have 16 patients that are being served in our COVID population. 13 of those have confirmed tests. 3 of those are still waiting for confirmed tests to come back. But that's really good. That's really almost down to 12% of our total patient population. Whereas if you looked at us back in May, it was significantly higher than that, almost half of our patients. And so really, really good statistics in terms of what we're seeing for the COVID patients, which is giving us that ability to really provide care across the board. We are not just COVID by far. In fact, again, more than 85% of the patients that are at our hospital right now are not there for any COVID-related reason. We have a total of 4 patients that are intubated at our hospital right now in our COVID ICU. Again, that number is extremely lower than what it has been in the past. So we have treated a number of COVID patients over the course of the last several months, over 500 in fact. And we've discharged over 431 of those patients. Others have been transferred out, but those are really strong numbers. Our organization has worked so hard, has worked together in so many ways to be able to provide that care. And we're happy to say that our trend is definitely on the downward slide in terms of COVID patients. But we're still here. We're still taking care of patients in all areas. And so if you look at those trend numbers, our trend data shows a decrease in the COVID patients, a decrease in the PUI, which is patients that we're still waiting for testing to come back. And that's really good news. And it's good news for our entire organization. You know, I want to say that we've done a lot of work around COVID within our community, within the Four Corners region. And we've done really good work as of the last couple of weeks, really driving our reopening of the organization. We're doing appropriate precautions so we don't have that resurgence. I know there's lots of discussion about a second wave possibly coming in the fall. That is a possibility, but we're going to be ready for that. What we said at the very beginning of this pandemic is that we are prepared but not panicked, and that's exactly how we're looking at things now. We still have lots of precautions in place. We don't want to cause unnecessary infections for our caregivers, our employees, our providers, and also for our patients. So we're taking lots of precautions, but we are safe, we are open, we are ready for people to come in and get the care that they need. So please, call the hospital if you need any kind of assistance. Call your primary care provider. Seek the care that you need, your regular screening processes. But we're doing well, and we're certainly trending downward, and we hope that that continues over the course of the next several months. So thanks a lot, and we'll be talking to you soon.
Hello. I'm Dr. Jason Lucas, orthopedic surgeon, and I'm Chief of Staff at San Juan Regional Medical Center. Thank you for taking the time to listen to this presentation. It's an honor to be with you. I wanted to let you know, first and foremost, that San Juan Regional Medical Center is open to serve you and for your healthcare needs. We are taking all comers. We have had a great experience preparing and caring for many of the COVID-19 patients. And our hospital administration, medical staff, with our nurses and physicians, have done a yeoman's work in caring for those with COVID-19. But unfortunately, during that time frame, there were many patients who delayed their health care, medical, and surgical care. And now we're starting to see a trend of those who have not received appropriate care in a timely fashion and are now dealing with those complications. We want to let you know at San Juan Regional Medical Center, we're open to all who need health care. And so, yes, we've taken care of the COVID-19, but we're also taking care of all patients in all fields, period. We want you to know that we are open for surgery, that when you come for surgery, you will be screened and tested just like all other patients in a safe environment. There is testing criteria established that we have spent many hours upon preparing for all patients to be seen and cared for. Just as COVID-19 has infiltrated all areas throughout the United States, and especially throughout the Four Corners, from Durango to Cortez to Gallup to Farmington to Albuquerque, all hospitals are dealing with this issue. It is not just our hospital, but I want to let you know that we've created a safe environment. 3 out of our 4 medical floors are COVID negative, meaning that they're all for those healthier patients who do not have COVID-19. We have prepared our surgical suites to give the best care for those patients who do and who do not have COVID-19. But we want to let you know, please do not delay your care. We have a great opportunity here to provide services to all of you here in the Four Corners community. And we feel that we have created a safe environment for you to come and receive surgery or receive that medical care that would best fit you. We are not just treating COVID-19 patients, we are treating all comers, and all precautions and safety precautions are being taken. We hope that you'll bring your family members to San Juan Regional Medical Center to receive that care, medical and surgical, for we feel that we provide a great quality service. And we want you to feel safe and know that we have taken the precautions necessary to provide you the best care. Please do not delay your healthcare needs because we're seeing those complications that have happened, but come and receive the services that you need, medical and surgical, at San Juan Regional Medical Center, and we will provide that quality care for you. Thank you for your time. God bless you, and have a great day.